we're joined in the studio by Richard Herts, a consultant on youth engagement and partnership at UNICEF. Richard, thank you for joining us. What's your take on why the rates of infection are rising in our region?
Thank you, Andrei. So actually, we need to understand the origins of where this epidemic can come from. And from your report project by UNICEF, we actually made a poll about sexual education at schools. So with this information from sexual education subject, young people, for example, can understand how they can prevent themselves from getting, for example, HIV. So by these statistics, we can see that only 42% of young people had the subject of sexual education in their schools. And even though, if they had this subject, they rate the subject, the quality of the information there, as 3.08. And what is given us in, as an example, that from all the people that we asked, for example, about did they have already sexual experience of sexual intercourse, from 14 to 21 years old, it's already 50% who already had sexual intercourse. And from them, only 45% are using contraceptives. And also one bad number I can tell is that 26% of those people who have sexual intercourse using as a contraception, they just stopping the intercourse as a method of contraception.
Well, not only Richard Herts has prepared some infographics, but Hromadske as well. And you can see now the infographics that we have prepared. In Ukraine, over 139,000 people live with HIV and AIDS. And every day in Ukraine, we get 48 people diagnosed with HIV for the first time. And among those people, 1 in 2 are unaware of their status. Have you touched upon the awareness issue in your polls?
About the awareness, not really, but we are cooperating with NGOs, for example, which are dealing with HIV epidemic. And for example, there is just not a lot of information given to young people about the threat of HIV. So they don't know that it is something that you should know, you should aware of, and you must save yourself from getting the virus.
How young are you?
I'm 23 years old.
Where did you get the information on HIV and AIDS? And can you say that you are better informed than your co-evils?
I was finishing, I have a bachelor degree in biology, and I found out about the virus actually, I got nice information from the university. But I can tell that at school we had just a little bit information about HIV. It was on a biology subject, and we had this information just as a part of getting to know the viruses, but not the threats, not how you can be saved from it, and not what you should do if you will still get an HIV, where you need to go. We didn't have this information, unfortunately.
Apart from the awareness issue, what are the biggest challenges that Ukrainians face in this respect?
Even if we will return to the poll results, for example, the best way to prevent ourselves from getting HIV, for example, is just a simple using of contraceptives. And as we can see by statistics, 19%, they had a problem that the condom price was too high for them. And unfortunately, it's not always easy to find a place where you can get a free condom. And also, we just don't have a lot of information which is given at schools, so we can fight with information with this problem. And for example, also just 10% but still they just feel shy to buy condoms because there is some kind of stigma in society that topics of sexual education, it's not a thing that you can discuss in public, let's say. And this is a big problem because our youth need to be informed of the problems which they can face. And if we're thinking that this youth is not is too young to have this information, the same thing. Our polls show that our people who were asked from, I will notice once again, from 14 to 21, they think that the average age where you can start your sexual life is 17 years old. It's not even 18 years old. So there are different opinions.
Well, so many people, so many different opinions.
Yeah.
And Hromadske's correspondent Maria Ulyanovska took to the streets of Kiev to talk with young people about HIV testing. Let's have a look.
Hey guys, do you know it's World AIDS Day?
No.
Have you ever tested for HIV?
No.
Why so?
I already know. I'm healthy enough.
Have you ever tested for HIV?
Yes, I recently got tested.
How was the experience like?
It went well in general. We have good medicine here.
Was it scary?
No, by no means was it scary.
And how about you?
No.
Why?
Well, I had no reason to check.
No,
Why?
I'll do it someday.
Why haven't you done it yet? Scary?
No.
Have you tested for HIV?
Yes.
Why did you do it?
Well, I was asked to, just in case.
Was it scary?
Yeah, a little bit.
No, I didn't do it.
Why so?
Well, because I'm not at risk group. I'm a married person, so there is no risk. I don't think I have HIV. It's an obligatory test when you go before the military commission.
Yes, and that's it. We haven't checked again, but it was like 3 months ago.
Was it scary?
No, I would do it again if there were grounds for doing it.
And what are the possible grounds?
Well, some kind of unfortunate intercourse, maybe.
Unfortunate intercourse sounds interesting. Do you know the ways HIV is transmitted?
Yeah, through blood, but I don't do anything bad to catch HIV.
Can you tell me, have you ever tested for HIV?
No, I haven't. Well, I never thought about it.
Yes, of course.
What was the experience like?
Well, it was normal. I knew the results, so it was okay.
Do you know how old I am? Could I have checked for HIV? What for? I've never done anything to need a test.
No, I didn't check. I don't know. I never had a chance, I guess. Or time.
The chances of getting HIV if a person has a normal lifestyle are minimal, but I don't consider it necessary.
Oh, yes, I did.
What was the experience like?
Well, it was very scary because I didn't know what results to expect. Nevertheless, it was fine.
Have you ever tested for HIV?
Yes.
Was it scary?
No, it wasn't. I used protection. What should I be scared of?
Richard Herts, a UNICEF consultant, is in the studio of Hromadske International. In the polls that you conduct, Richard, do you get answers from the entire territory of Ukraine, or do you get answers only from the what we call the controlled areas?
Well, actually, yes, we get in the information only from controlled areas here. We can say that we don't have data from the Crimea, and we don't have data from the Far East territories, unfortunately.
From the occupied territories in the east of Ukraine, you mean?
Yes.
Russia's invasion of Ukraine has also had an effect on efforts to combat HIV/AIDS. Here we have some figures on the HIV/AIDS situation in Ukraine's occupied Donetsk and Luhansk regions and in the Crimean Peninsula, which was annexed by Russia. And you see that in the occupied part of the Lugansk region, around 3,000 people live with HIV, and about around 16,000 people live with HIV in the occupied part of Donetsk region. As far as the next Crimea goes, here the data, the modern data, is actually unavailable because it is so much controlled by Russia. But as of the 1st of February 2014, when the territory was still controlled by Ukraine, we had almost more than 8,000 people living with HIV there and more than 1,100 living with AIDS. As for other territories, what is the breakdown according to your polls? I mean, where in the controlled territories the situation is the most serious?
Well, this poll was conducted only for the whole Ukraine, and I can tell for sure where the situation is, let's say, bad. But as far as I know from other polls which were conducted by other organizations, the statistics in Ukraine shows that most problematic, let's say, regions are the big cities like Odessa, like Lviv, like Kiev. And yeah, this is the places where maybe we should start do something.
We also spoke with Valeria Rachinska of the All-Ukrainian Network of People Living with HIV/AIDS about continued efforts to treat HIV patients in the occupied territories. Let's see what she had to say.
Around 3,000 people are living with HIV in the parts of Luhansk region not controlled by the Ukrainian government. In uncontrolled Donetsk region, there are roughly 16,000 people. Before the war, the Donetsk region actually had the highest HIV prevalence across Ukraine, and in 2014 there were 20,000 people living with HIV in the Donetsk region. The people living in the government-controlled areas have no access to HIV testing, because all infrastructure was left behind in the uncontrolled areas. We're talking about a big AIDS centre with the largest diagnostic equipment and the best doctors, but it was all left behind in the uncontrolled areas. So in terms of the quality of HIV care, these days the uncontrolled areas do a lot better than the ones that are controlled. We have launched an AIDS centre in Slovyansk, employed by some staff, bought equipment, and it's starting to function. We hope that this month we will finally acquire viral load testing equipment, which we haven't had in the government-controlled areas since the military action started. Yes, fortunately, all the people receive care as they did before thanks to the Global Fund organisation, which fights AIDS, tuberculosis and malaria. Because when the war had just started in 2014, no one knew what to do. The concept of the war was new to Ukraine. No one knew what to do, even in terms of access to HIV care for HIV and tuberculosis patients. Later, after the war started, a new service was launched, telephone consultations for people who live in zones that have military actions going on. Given the fact that now there is a border, a front line, and we have logistics problems, even if people from uncontrolled areas call social workers who work in the Donetsk or Luhansk regions on grants, they will receive consultant help of any kind. So our task is to make sure our clients receive all the resources we can give them, no matter which part of Donbass they live in. The medications are brought directly into Donetsk and Luhansk. Both cities have AIDS centres. UNICEF facilitates this delivery because they, as an agency, have the legal right to work in uncontrolled territories and transport medications. There are diagnostic centres. The healthcare system that was launched before the military action started still operates quite well. The medical staff retain their jobs, doctors carry on working and testing people, new diagnoses are made, people receive HIV care. That's a pretty good result actually. All the services still operate. I can't say there are no problems at all, because there are. There are high personnel turnover rates, people are quite constrained, maybe that's because of the war too. People are unbalanced psychologically, but it's hard to be balanced when you live in the areas that have been shelled. All of this, of course, affects people's willingness to get tested, receive care, and hinders their access to diagnostics. But nevertheless, it all functions, and that's good.
You get these thousands of text messages in response to your polls, but how do you acquaint the Ukrainian authorities with what young people say?
Well, for now we are mostly working with NGOs. Unfortunately, we didn't get still the data to the ministry, for example, but we are planning to do that because this is the way where we can do much more changes. For example, these polls were conducted with the organization of Teenagizer. They are volunteers who are actually, they're activists who advocate the problem of HIV epidemic in Ukraine. And they actually doing pretty well work.